Welcome everyone to the Young Person SC Child Safeguarding Practice Review webinar. I'm Jade Maynard, Practice Development Coordinator from the Children's Safeguarding Partnership. I'm co-delivering this with Lucy Edwards, also from the Safeguarding Partnership. We did deliver this session twice virtually across partners. However, we know that all partners were not able to attend, so we've pulled together this webinar.
Hi everyone, I'm Lucy Edwards. I'm the Practice and Quality Review Officer for the Safeguarding Partnership. So part of my role is to coordinate child safeguarding practice reviews. So just a really quick overview of today's session. So we're going to be sharing the learning from a CSPR that we published back in March 2023. And what we really want you to do is think about what this means for you as practitioners. So we want you to think about, what does this mean on an individual professional level? What does it mean within your agency? But also, even more importantly, what does it mean for us collectively as a partnership? So what can we do differently based a sort of self-care reminder and a sensitive content warning on two levels, really. So firstly, we're going to be talking about the murder of a young person. So obviously, that's something that is really distressing to talk about. Some of you may have known this young person personally or professionally, but even if you didn't know him at all, it's obviously, a really upsetting thing to talk about. We're also going to be talking about some really sensitive issues around disproportionality and how people are treated differently based on their race and their background, which again might be something that you have experienced yourself personally or professionally. You could know somebody who's experienced it. So we know that this is really sensitive content, and we just wanted to remind people to seek support if they need to. So please go and speak to your line manager or a trusted colleague. Seek support from. I know a lot of agencies have like external counselling support services. Please do go and seek that support and guidance if you need to do so. We just want to be clear as well that throughout today's webinar, we're going to be referring to the young person as SC. We know that a lot of you will know who this young person is based on the media coverage at the time of the incident and at the trial as well. Again, some of you may, have worked with the young person, but just to say we're given quite strict guidelines around how we refer to children and young people as part of CSPRs. So that's why we're going to be referring to him as SC throughout today's webinar. So just very quickly at the start, then a bit of an overview of what a CSPR is, as a reminder for people or for people who don't know what a CSPR is. So it stands for Child Safeguarding Practice Review, and CSPRs replaced serious case reviews in Sandwell back in 2019 when we became the Children's Safeguarding Partnership. So there's two key criteria that we have to meet. There has to be the child has died or been seriously injured, and secondly, abuse or neglect has to be known or suspected as a causal factor in that incident. So obviously in this case, sadly the young person had died, but it was slightly different with regards to the abuse or neglect context, because a lot of the time for CSPRs, it's something that's happened to the child in the home. This young person was very much a victim of the contextual safeguarding and was a victim of exploitation. So just to be clear, it was that gave the concern around abuse or neglect with this incident. There must be multi-agency learning, so CSPRs are never just about one particular agency. It's about a collective of different agencies and how we work together as a partnership. They should be analytical and use what's happened to the young person or the child as like a window on the system, really. So to really focus in on a particular area for our safeguarding practice and our processes. They're always reflective and constructive, so we always identify and build on the good practice that's happening in Sandwell, as well as obviously identifying those areas to focus on that we need to keep, working on and improve on. We always include the voice of practitioners to inform the learning and tell us what's going on in Sandwell, where the challenges are and so on. And where possible, we always include the views of the family as well. So in this case, the family were offered the chance to contribute, but chose not to, which is, their right to do so. And just to reiterate as well that we always use pseudonyms as well to anonymise within our reviews that we do. So a little bit of background about young person SC. So he was a British male of Black Caribbean heritage, lived in Sandwell throughout his life, mainly with his mum. There was a short period of time when he lived with his father. but mainly, like I say, mainly lived with mother, and he was part of a large extended family and was a really, much loved member of his family. When he was at primary school, he received some fixed term exclusions, which eventually led to him attending a pupil referral unit, or a PRU. When it was time then for him to move up to secondary school, that then led to a bit of a challenge to identify the right setting for him. And sadly, as a result, he did miss quite a lot of schooling, which in turn then hindered his academic progress, because sadly he'd missed so much of school. He had an education and healthcare plan, or an EHCP, for social, emotional, and mental health needs. School described him as a young person who could be quite impulsive and really benefited from that positive role modelling, particularly from male members of staff. And there was a history of concerns throughout his childhood, regarding neglect, parental substance misuse, domestic abuse, and poor mental health of parents as well. So we saw that concerns really began to escalate for this young person from around 2015 onwards. So there was increased police involvement and episodes of criminality where this young person was recorded as a victim of crime, but also as a perpetrator of crime as well. Now, just to be clear, when we're describing him as a perpetrator of crimes, this was an exploited young person. So it must be viewed through that context, that this young person, didn't have a choice about the activities they were involved in. This young person was a victim of abuse. So just to be clear on that, there was increased missing episodes. There was evidence of links to county lines and local gang activity as well. There was a period where SC was on a child protection plan back in 2018, and he received support through the Youth Offending Service and TSA, which is like a mentoring support service for young people who are linked to gang activity. There were 3 emergency department attendances between 2018 and 2019, all with injuries thought to be caused by assault, and one was a leg injury where he said he'd been jumping over a fence. We see from about 2020 onwards, we see that there were the efforts by agencies to engage SC were unsuccessful. And again, a little bit more about him as a person. School described him as someone who could have really low self-esteem and present as quite anxious, especially when, on school trips, for example, he presented as hyper aware. And he was a young person who tried really hard to learn and participate and just fit in like a normal kid, really. But obviously, with everything else that was going on in his life and having missed such a lot of school, this was a real challenge for this young person. But despite everything that was going on in his life, he achieved a GCSE in maths and expressed ambitions to be a barber when he was an adult. So SC was 17 years old when he was out in the community and was stabbed multiple times. Despite attempts to save him, he was taken to hospital but sadly died shortly afterwards from his injuries. An 18-year-old male was quickly arrested and charged and has subsequently been found guilty of his murder and sentenced to life with a minimum term of 20 years. We know that SC and the offender were known to each other, but we don't know what triggered the fatal attack on that day, and it's probably something that will never be known. Okay, over to you, Jade.
Thanks, Lucy. So just to talk through the CSPR approach that we used for the young person SC. So once the rapid review had been completed, it was agreed to use a different approach rather than traditional CSPR. So in that, we did a thematic review that was led by the Child Exploitation Board, using SC's story to really examine systems and practice across Sandwell, across all the partner agencies. How we did that was we formed 2 task and finish groups that examined the systems and practice using CEB members and partners across all agencies. The 2 task and finish groups were a task and finish group that looked at disproportionality and one that did a spotlight review on school exclusions, missing, and EHCP and SEND. So the disproportionality task and finish group really looked at a cohort of young people, especially in the youth justice system, and how Black children are seen and perceived and linked to gang and exploitation. And that was really evident that there was disproportionality across the statutory areas of our systems and less seen within the early help spaces. The cohort of young children being exploited and linked to school exclusions. We looked at policies, school behaviour policies, exclusions policies, and really examined our systems and processes locally and nationally. So we looked at what the national guidance says and what we do in Sandwell to really pull together that evidence to look at what is happening across our systems in Sandwell. So what is disproportionality? Now, when we did this virtually, we did do a group discussion. However, it might just be worth pausing the recording and taking a minute to reflect what is disproportionality means to you within your service and with your organisation, because on the next slide, we'll describe and give you a definition of what disproportionality means. So what is disproportionality? Racial disproportionality and disparities are problems affecting children and families of colour in the child welfare, juvenile justice, education, mental health and healthcare systems. The term disproportionality refers to the ratio between the percentage of persons in a particular racial or ethnic group at a particular decision point or experiencing an event, compared to the percentage of the same racial or ethnic group in the overall population. So what needs to change in practice and in systems? So the issues and learning that has been found, and when we examine the practice, we know that it isn't just a local issue. So disproportionality, this is national. It's not something that's just happening in Sandwell. It's not unique. And it is something that is across all of the country. Processes when children present to ED with injuries caused by youth violence. So this is in regards to the safeguarding of that child or young person. So yes, when they're presenting ED, the injuries and the health care is the priority, but also it's around that safeguarding and that what is happening for that child. Is there exploitation? Are they at risk? And there's lots of work formed from that has followed on from the learning of this that is already happening. Looking at the consistent application of behaviour policies in schools. So yes, schools have got back behaviour policies, but it's around making sure they are consistent across all of our young people, challenging behaviour policies, looking at what's happening for that young person and that behaviour policies are being consistently applied. Understanding the lived experience of children attending alternative provisions and the impact of their life chances. So this is around really understanding that, yes, we know young people and children that are excluded or permanently excluded from school got poor later outcomes in life. So it's around really understanding what is the best environment, what is that young person's needs, and looking at alternative provisions and what is the best place for that child to learn and to thrive and to ensure that we don't impact negatively on their life chances. Treating people, young people, fairly and equally, and also improving how we collect and use data and address gaps. So when we was in the task and finish groups, it was evident that some services and organisations wasn't always collecting data around ethnicity and around their provisions and services. So this is one of the key things that has been highlighted across our partnership. So recognising and responding to early signs. So as we say, the earlier the better. As Lucy mentioned, this young person was known to services very early on. So it's looking at how we engage and ensure that the support and agencies are involved at the earliest opportunity. Understanding challenges and barriers preventing Black and marginalised ethnic families accessing early help. So when we looked at data and services from the early help space right up to statutory, there was less Black families and ethnic families accessing early help in comparison to later on in the statutory services. So it's around understanding them barriers, them challenges. And actually, it's not that families and young people won't engage with us, it's that we're not engaging with them as practitioners and services. So it's around ensuring that we really be creative, understanding families, their culture, their background, you know, how we work with them in different ways, how we change as practitioners to really engage with families. Also ensuring policies and guidance are adhered. So, for example, school behaviour policies, the educational neglect, the was not brought policy. So there's a number of policies that we've got in Sandwell in different services, and really ensuring that they're used to the full and adhered to. And as practitioners, we need to challenge each other in the right way to ensure that policies are being followed and adhered to for all of our families and children. And again, just to summarise, the earlier we intervene, the better the outcome. So just finally from me, a quote. Somebody brought this to one of the Task and Finish groups from Dr. Alex Chard. Poverty, disadvantage and social exclusion are linked with systematic failure to address their needs, creates a conveyor belt which propels vulnerable children towards exploitation and crime.
Thanks, Jade. So just to round off then, these are just a couple of facts that we saw. So there was obviously a lot of research and literature reviews that went into the CSPR itself. And these were two facts that really kind of stood out as part of the research. So Black children are at least 4 times more likely to be criminalised than their white British counterparts. And secondly, a Black Caribbean boy who's eligible for free school meals and who has SEN or special educational need is 168 times more likely to be excluded than a white British girl with no additional needs and who is not eligible for free school meals. So we're just wanting to leave on that point really, just for you to reflect on within your teams. So just to summarise, and as Jade said, SC was known to many services from the very earliest months of his life. The CSPR found that he did experience neglectful and compromised parenting, and we now know that there's lots of complexities in the system. So even when those early indicators are there, we're not always seeing all of them holistically, and that's something that we need to keep working on, and that we're already focusing on within the partnership. Early signs can often present in primary school. So obviously we're always mindful in CSPRs of hindsight. It's very easy to look back after an event and say, oh, we could have done X, Y, and Z. But just really important to kind of note those things that we see early in primary school, often described as behaviour challenges, difficult to manage, and so on. Those can later in life escalate to even more serious issues. So important to kind of respond to those at that early stage. We see that there's a direct link between school exclusion, exploitation, knife crime, and the youth justice arena as well. And we really want people to think about language and perceptions and how easily kind of negative descriptions and labels can stick for young people. So as we say about, them being challenging, them misbehaving as a young child, that can often stick throughout their life as well. So just being really important of how that can kind of impair your assessment and judgment of a situation. The CSPR did find lots of evidence of local good practice, and we'd encourage you to go and have a look and read the CSPR in full. And as Jade said, we really do need to see a national steer on some of these issues around disproportionality, because they're not just unique to Sandwell, but we really need to see something that everybody across partnerships in England needs to kind of sign up to and deliver in their local areas. And then I think we've kind of said this a couple of times now, but just to reiterate that message, the earlier we can intervene with children and young people, the better the outcome for them. And we just want to remind you that, we've obviously spoken about some really sensitive and upsetting things today. Please do seek that further support if you need to. And then finally, we've just got some links to some further reading, so things that we've got here in Sandwell, and also some national publications as well. So please do, if you get a chance to, go and have a look at those as well. And from both of us, a big thank you for listening for today's session. Thank you.
Thanks. Bye.
Bye.